A mother is on a mission to get a very important health message out to the medical community, parents, and especially young adults and teens. Her passion earned her a spot on a task force with the World Health Organization. But as Meg Ferris shows us, that mission came out of a family tragedy.
Emily Stillman was 19, a sophomore in college in Michigan, when one night she called home.
She called me with a headache. And when she was taken to the hospital, she walked into the hospital with a backpack, a textbook, her phone, her computer. She wasn't going to die.
It was bacterial meningitis. 20 hours later, Emily was gone.
When I said goodbye to my daughter, with tubes coming out of every part of her body, I promised her I would figure this out.
Alicia Stillman thought she had done everything right. She had gotten Emily a meningitis vaccine and booster. But there are 5 bacterial strains that can be deadly. And back then, there wasn't a vaccine for the type Emily contracted, meningitis B. But now there is.
So these tools are available to providers, to parents, to these patients, the young adults and the adolescents that I didn't have available to me.
It's the behaviors, it's the sharing of the saliva that puts these children at risk, and that's why they really need to be vaccinated.
Experts say while babies can contract the bacteria and get a vaccine around 3 months of age, it's especially important for adolescents to get the vaccine. The recommendation is the first one at 11 and the booster at 15.
They share forks and knives, they share food, they share joints, they share water bottles, they share chewing gum. Their judgmental part of their brain doesn't really mature till they're about 22 years old. So they do these things and they don't think anything of it.
Bacterial meningitis can also raise the risk of having limbs amputated, like this young woman when she was in college. So make sure your vaccine protects against all 5 strains.
These vaccines are so purified and are so safe. The biggest problem getting the vaccines is having a sore arm afterwards.
And by sharing my story, by sharing my heartbreak, I believe that I could help save another life.
Meg Ferris, WWL, Louisiana.
And for more information, we have a link to the American Society for Meningitis Prevention with the story on WWLTV.com.